It's a delight to welcome you to yet another edition of NAFDAC and Your Health, brought to you by NAFDAC, that agency that has the constitutional mandate to safeguard the health of Nigerians by ensuring that only wholesome food products, as well as quality and approved drugs, cosmetics, and medical equipment are made available for their use. I am Amanda Ugo.
On today's edition, we'll explore what antimicrobial resistance is, the colossal danger it poses to public health, and what efforts should be made to eradicate it. Then we'll go on to feature the 2024 edition of the World Antimicrobial Week as commemorated by NAFDAC in conjunction with the Danish Embassy and the Ministry of Environment and Food, Denmark. One of the major challenges bedeviling public health and has taxed NAFDAC as a regulatory body controlling the administration of food and drugs in Nigeria is antimicrobial resistance. This phenomenon is one that has been on the increase, exposing the public to great danger by the day.
A livestock is not supposed to be fed with medicine unless there's a disease. And that disease has to be monitored, or the treatment has to be monitored. But in a situation where you indiscriminately add that to their feed, it affects us. Antibiotics, for example. When a livestock or animal, whatever, is fed antibiotics indiscriminately, we take the antibiotics when we eat. And before you know it, we may be building resistance. Because you take a little bit, maybe you take 1/20th of what you are supposed to take if you are really sick, but the 1/20th is coming from the meat. And I keep taking it, the 1/20th is not going to kill any microbes. Before you know it, the microbes will start building proteins around themselves because it's not killing them, so they want to also build a coat around themselves. That is how human beings develop antimicrobial resistance. Antimicrobial resistance is doing a lot of damage worldwide. Because what happens then is the doctor now gives you a medicine, an antibiotics for a particular disease, ailment, and it doesn't work. Because the microbes have built a coat around themselves, they've developed resistance against that medicine.
Owing to the enormity of the havoc antimicrobial resistance is capable of causing, it behooves on NAFDAC to key into all efforts geared towards nipping the menace in the bud. This is why the NAFDAC Directorate of Veterinary Medicine and Allied Products, which is the directorate under whose purview the responsibility falls, has always risen to the challenge, working frantically in collaboration with other directorates of the agency and relevant stakeholders to fight antimicrobial resistance. Part of this is the commemoration of the World Antimicrobial Resistance Week.
NAFDAC and Your Health continues after the short break. Welcome back. You are still watching NAFDAC and Your Health.
This year's event, themed Educate, Advocate, Act Now, commemorated in conjunction with the Danish Embassy and the Ministry of Environment and Food, Denmark, was held at Marriott Hotel Ikeja GRA, Lagos, between the 21st and 2nd of November. Declaring the two-day event open, the Director General of NAFDAC, Professor Mojisola Adeyeye, emphasized the significance of the World Antimicrobial Week, the risks caused by antimicrobial resistance, as well as how she herself was once a victim of the life-threatening phenomenon.
This week provides the agency an opportunity to raise awareness about one of the most urgent global health challenges of our time, antimicrobial resistance, often referred to as the silent epidemic. The person that you are looking at now, myself, was a victim or self-inflicted victim of antimicrobial resistance. That was about 50 years ago, working after my secondary school in the hospital. And I will go and get medicine for one thing or the other, but I will never complete the course. Once the symptoms disappear, I stop using the medicine. I was just about 18, 19, years of age. You can add everything together now. So I became very ill. One of the long vacations, I became very, very ill to death. My temperature was 106, 107, and I was very early in the morning when I was passing away. I was rushed to Adeoyo General Hospital in Ibadan. And they had to put a Macintosh on the bed and started pouring water and ice block on me to cool my body down, because I was misusing antibiotics. So when I got to University of Nigeria, Nsukka, for my pharmacy education, I was already sensitized about how not to misuse antibiotics. AMR is not a distant threat, as you can see. It is already impacting our lives. Infections, once easily treated with antibiotics, antivirals, and antifungals, are now becoming increasingly difficult and sometimes impossible to manage. This growing resistance endangers decades of medical progress, potentially reversing our success in treating common infections, performing surgeries, and conducting medical procedures. The most pressing danger is the resistance found at birth in newborn babies. The implication of AMR to human race is unquantifiable because it poses threats to man, animal, and plants. NAFDAC, in our regulatory activities, have identified the danger posed by AMR and have taken due diligence to identify the likely causes, which range from the effect of substandard falsified medicines, pharmacists not counseling patients very well, patients misusing antibiotics like I did, veterinarians not advising their clients very well, sacrificing animals before the washout period when antibiotics is given, and then they sell it to us, and we eat and eat and eat and eat and eat. And after a while, we develop antimicrobial resistance.
The NAFDAC DG also enumerated the regulatory mechanisms developed by NAFDAC to combat AMR.
The agency, leveraging on our mandate, as stated in NAFDAC Act Cap N1 2004, therefore developed the following regulatory mechanisms to combat AMR. Review of the formulation of antibiotics. The agency directed that all antibiotics formulations should not have more than 2 APIs. This directive is aimed at curbing the excessive use of antibiotics, which may lead to development of resistance. The agency is also working assiduously in terms of monitoring the quality of antibiotics in the market. We do annual survey using statistical approach, getting samples from all over the country to test the quality, because it's not just misusing, it's if the antibiotics is substandard and you use the full course, you may still get resistance. Another mechanism we're using is to ban the use of antibiotics as growth promoter in livestock production. This directive aimed at discouraging the use of antibiotics at sub-lethal dose, which is a very effective means of encouraging resistance by non-beneficial microbes. Alternative growth promoters such as organic acid enzymes, probiotics, and prebiotics are cheaper and available for livestock production. Another means that we are using is to ban on the use of colistin as codiciostat or prophylaxis in poultry and swine production. Therefore, colistin, or hitherto rather, colistin is used as technical additives in poultry and swine feed. However, upon reclassification by WHO, colistin is presently considered a last line of defense against human infection caused by multi-drug resistant gram-negative organisms. The agency has also banned the use of antibiotics as mold inhibitor. In combating the growth of mold on animal feed and feedstuff, nutritionists use antibiotics to prevent mold growth, thereby preventing the formation of toxins. The use of organic acid for this purpose is more effective and efficient. In addition to the above, the agency created an in-house AMR committee that collaborates with other sister MDAs, such as NCDC, Federal Ministry of Agriculture and Food Security, Ministry of Environment, Ministry of Health and Social Welfare, and other development partners such as WHO, Ragnar of EU, among others, in combating AMR. The agency also stepped up advocacy and enlightenment campaign on the danger of AMR to stakeholders, professionals, and farmers. As we mark this important week, which has now become the agency tradition, we recognize that AMR respects no borders. It is a global issue requiring coordinated national and international solutions. Together, we must commit to the responsible use of antibiotics and other antimicrobials, support ongoing research, and promote stewardship programs and policies to safeguard these essential resources for future generations. NAFDAC's regulatory efforts on AMR include ensuring the quality and controlling the distribution of antimicrobial products, implementing stewardship programs to ensure responsible handling and use of antimicrobial agents, and conducting public awareness campaigns.
The NAFDAC DG also commended the Danish government for being a staunch supporter of NAFDAC since she came into office. Speaking earlier in her welcome address, the Director, Veterinary and Allied Products Directorate of NAFDAC, Dr. Ramatu Mamadou, stated the reason for choosing the theme of this year's commemoration of the World Antimicrobial Week and the efforts that still has to be made to raise global awareness on AMR.
AMR is a pressing global health and economic crisis. It has significant impact on human, animal, environmental health, and food production. Drug-resistant pathogens pose a threat to everyone and everywhere. Yet, much more can be done to raise public and stakeholder awareness. Therefore, this year's theme calls on the global community to educate stakeholders on AMR and advocate for bold commitments and take concrete actions in response to AMR. During these 2 days, we will be raising awareness about antimicrobial resistance, promote practices in the use of antibiotics, and work towards global solutions that will help safeguard the effectiveness of these life-saving medicines for future generations. I wish to reiterate that AMR is a silent but deadly threat that transcends borders, affecting people, communities, economies worldwide. It is a challenge that requires our collective commitment and action. We want to thank our Director General for her technical and financial support towards this program. We also want to appreciate the Danish government for making this day a reality by providing the financial and technical support through the strategic sector cooperation, the Royal Danish Embassy in Nigeria, and the Danish Veterinary and Food Administration.
The ambassador of Denmark to Nigeria also explained the reason Denmark is supporting NAFDAC and collaborating with Nigeria in the fight against antimicrobial resistance and the future plans of the partnership.
And since 2017, Denmark has operated within a national action plan for antimicrobial resistance. And a new action plan will be developed during the coming year, 2025. However, antimicrobial resistance is a global health challenge. It is one of the major causes of death in the world and therefore recognized as being among the greatest challenges for global public health. AMR therefore requires global solutions. In Denmark, we are extremely aware of this and are committed to dialogue and sharing of our experiences through international cooperation, exactly like what we are doing here. And therefore, I'm also so happy that we here in Nigeria have a well-established collaboration between the Danish Veterinary and Food Agency and the Danish Ministry of Food, Agriculture and Fisheries and the Nigerian like-minded authorities, the National Agency for Food and Drug Administration and Control, NAFDAC, and the Federal Ministry of Agriculture and Food Security. The collaboration runs within the Strategic Sector Cooperation, SSC, Nigeria, and focuses on capacity development and transfer of experiences between the authorities on matters of food safety and sustainable livestock production. The partners have agreed to collaborate, particularly in 3 focus areas: food and feed safety and management, animal identification and traceability, and disease control and prudent use of veterinary drugs. The collaboration between the partners is complemented by a learning program by the NIDA Fellowship Center, where the Nigerian partner staff are provided with training in related topics such as food safety, disease control, and One Health approaches. The Danish partner is particularly well suited to facilitate both transfer of knowledge and experience with regard to actions to combat the spread of antimicrobial resistance, as they are currently working under a comprehensive national action plan against antimicrobial resistance in livestock and food, which I believe that they have been able to share during this event.
Presentations on various subjects bordering on ways to combat antimicrobial resistance were made in succession. And Sophie Hinsman of the Danish Department of Veterinary and Food Administration opened the session with her presentation titled Good Management Practices in Poultry Production. This was followed by Dr. Jason Wim's presentation titled Danish Regulations and Initiatives in Combating Antimicrobial Resistance. Among other presentations made on the first day of the workshop was the one by Dr. Tunde Shigbeku, a deputy director in NAFDAC and the focal person on antimicrobial resistance in the agency, which was titled The Role of NAFDAC and Regulatory Policies in Combating Antimicrobial Resistance.
Antimicrobial resistance is with us, is alive, is fighting us hard. And that's the fact we need to know. A recent incident is the hospital-born baby with colistin resistance. Did you mention it all the time? Most of us must have come across it over the social media. And when we had our in-house AMR committee meeting, that report was brought up. How did it happen? And I can tell you freely that when I was in the nutrition class in school, part 3, you do nutrition, animal nutrition. when we want to do exercise of formulation, and I thank God I have some of my senior colleagues here, when they go to the board, not like nowadays that you use interactive board, chalk and blackboard, they will write all the ingredients that we want you to formulate with, give you the cost. But when it comes to methionine, lysine, and choline, they put it in statutory. That's how I was taught animal nutrition. Choline inclusion in poultry feed as cholesterol, and in swan ration is statutory. Is a point you can't miss, because as they write all the ingredients, they put it there at the mission. And that is what we inherited from whichever way we were taught nutrition. And when I went to DG Santé training in Rome, that was 2014, when we bring up the issue of cholesterol, the trainer from the EU made us to know that the use of cholesterol as technical additive has been in existence for over 400 years. So why will a baby not be born with the resistance? That's how for us to see the danger that is inherent in this AMR that we're talking about. Let me give you a good picture. A young girl that is born in 1977, follow my analysis very well, born in 1977 to a farmer family. From age of 9 months, he has been consuming eggs from the father's farm. And the eggs are coming with the residue of cholesterol in it. And he lived on that egg for the first 18 years of life. Average farmer family that take egg twice in a week. Going further, after 18 years, he goes to the university. He still takes egg from our father's farm to the school. Graduated and got married. I can bet it for free that cholesterol residue is in her blood. She now got married and gave birth to this wonderful baby girl. How would I not be resistant in that girl? Do we get the picture? And that is what we're living with.
Among the stakeholders represented at the two-day event were the Federal Ministry of Health and Social Welfare, Federal Ministry of Agriculture and Food Security, Pharmaceutical Council of Nigeria, Poultry Association of Nigeria, Nigerian Medical Association, Veterinary Council of Nigeria, Medical and Dental Council of Nigeria, Association of Community Pharmacists of Nigeria, Association of Hospital and Administrative Pharmacists of Nigeria, and All Farmers Association of Nigeria.
That is all we have for you on this edition of NAFDAC and Your Health. We'll be back again next week with another incisive package. But before then, why not join NAFDAC in the efforts to nip the menace of fake, substandard or unapproved food products, drugs, cosmetics and medical equipment in the bud? If you have any information on these criminal acts, please reach out to NAFDAC.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Let us join hands to safeguard the health of Nigerians. Do not be a party to the production, importation, distribution, marketing, advertising, or selling of unwholesome food products, fake or substandard drugs, cosmetics, and medical devices. By doing so, you are endangering the lives of the Nigerian people. Till we meet again next week, stay healthy.